Recently, it has been reported that the number of people living with MS is greater than previously known. Dr. Mitchell Walleen discusses the significance of epidemiology and its implications for the diagnosis and management of MS.
Hi, my name is Mitch Walleen. I'm a neurologist and director of the MS Center of Excellence in the VA system. I'm also a neurologist with academic appointments at Georgetown and the University of Maryland. Today, I want to talk to you a little bit about the importance of numbers as it relates to MS. That is, why numbers matter. I'd like to start by pausing for just a minute and asking you to think of the first thing that pops into your head after you hear the following figures. 1776, 3.14, and 55. With 1776, you may have thought of the Declaration of Independence or a 4th of July holiday. With 3.14, you may have thought of the area of a circle, or potentially a frustrating high school geometry problem. With 55, you may be envisioning going down a highway in the United States, or perhaps sitting on the side of a highway in front of a cruiser trying to explain why you were speeding. These numbers matter in our everyday life, not intrinsically, but in what they represent. And the science of numbers is in the domain of epidemiology. And epidemiology is really the scientific study of the disease patterns in populations. And they spread these numbers by space and time. The classic example is the use of the epidemiologic method to track disease. And John Snow used this method to trace the cholera epidemic in 1854 London to the Broad Street pump. Here this pump was being contaminated by a sewer line, and when the pump was turned off, the epidemic attenuated. A recent report by the Global Burden of Disease Group found that neurologic conditions as a group were the most common cause of disability worldwide. And we know that among neurologic diseases, headaches are the most common. From this study and from around the world, we know that MS is the most common progressive cause of neurologic disability in young adults. And I'd argue that epidemiology is the essential tool that helps us with the frequency, cause, and impact of MS and other neurologic conditions. So there are a number of personal influences that I had that led me on my path to consider neurology and even epidemiology. Family influences were instrumental early in life. My mother was diagnosed with epilepsy after a head injury in college. She was able to respond to a number of medications, and over the course of her life, she became seizure-free and led a productive life. My father was diagnosed with a primary brain tumor in his late 40s. He died within 4 years after surgery and radiation. My siblings and I, and my parents, had some basic questions. How common were these disorders? What caused them? And what was the course going to be for them and us as a family? And I'd argue these are common questions that people ask after a diagnosis of MS. And the field of neuroepidemiology has produced some of these answers, not all of them, but some. And after I dealt with some of these things growing up, I became intrigued with causation and even neurology as a field. I went to medical school, got my degree, and then went out to Johns Hopkins and learned a little bit more about epidemiology and public health. A number of my mentors said it's okay, you can actually take neurology and epidemiology and bring them together. Probably my most influential mentor was John Kurtzke, who was really one of the forerunners of this field, and he really taught me the importance of MS and its unique epidemiology, and the importance of large data sets and numbers, and how to use them effectively in evaluation of disease. Let's turn to some basic concepts on epidemiology. There are two measures of frequency of disease that I'd like to present: prevalence and incidence. The prevalence is the number of cases in full in a population, and it's at a given point in time. An example would be a lake full of fish, where you'd count the number of fish on a particular day. Incidence is the number of new cases in a population over time. So in the same lake, it would be the number of new fish that are encountered over a given period of time, let's say a year. It's either the fish that will be born or migrated in from other areas. Incidence is more of a dynamic concept, and it's much harder to measure in a population. And the relationship between these two variables is the prevalence equals the incidence times the duration. And the duration in this formula relates to survival. So it's important to understand what numbers represent because they are inherent measures of a population, and these numbers are often thrown around in studies, but it's important to have an idea of what people are talking about. So when we switch to MS, how common is MS in the United States? It's a good question. You think it'd be pretty easy, and many people come up to me and say, well, why don't you just look at all the cases and divide by the number of people in the United States? Well, it's a little more complex than that because the health system we have is fairly fractured, and it's harder to count people, especially early phases of life. But there's only really one attempt to do this, and people are a little surprised by that. In 1976, a group led by Baum and Rothschild produced a prevalence number in the United States. And the actual number of cases was 58 per 100,000. And that translated to 123,000 cases in the United States. And this number was, for many years, the only thing going. And what happened over time is that investigators tried to adjust for population growth. The last time this was done was in the year 2000, where a 400,000 figure was actually put out as the measure of the number of cases in the United States. So the problem is that the US doesn't have a system that is able to look at prevalence figures or any measures of frequency for common neurologic diseases. And so with that, a number of people have looked at different ways of approaching this problem. One approach would be to use a survey. And this is exactly what Baum and Rothschild used in their study. They surveyed physicians, hospitals, and patients to come up with their number. The CDC uses a number of surveys as well, and the most common or largest survey that's done every year is called the Behavioral Risk Factor Surveillance Survey. It's done in every 50 states, and common diseases are looked at every year. The problem with surveys is that there's a lot of diagnostic uncertainty, and there may be over or under ascertainment of cases depending on how the survey is done. Another way of looking for cases and looking at prevalence is through registries. Now, registries are just basically databases of cases in the population. And it's important to feed cases into these registries, and a number of ways have been developed to do this. With the age of the internet, there's a lot of patient-generated registries. In the past, usually providers have been the gatekeeper for registries. Usually there's a mandate legislatively or some incentive to do that. And registries are a great tool. One of the most common registries for MS is the NARCOMS registry, the North American Research Consortium on MS, and has produced a lot of important data. The downside of registries is that they're expensive to start and maintain, and they also take a long time if you're going to look at the whole population to accumulate the cases you need to get to your endpoint of prevalence. A third way of understanding and looking at prevalence in a population is through large data sets, the so-called big data approach. This is a relatively recent approach because of the power of computing. And it's an effective approach as long as you have a way of looking at the data and coming up with cases. This is called an algorithm. In other words, it's kind of a recipe that the computer uses to actually identify cases. And ideally, this is validated, and if that is the case, if you have a validated algorithm that can look at large data sets, such as Medicare or Medicaid, you can have an efficient way of coming up with prevalence and incidence within a population. So the MS Society has been frustrated by the length of time it's taken to come up with a prevalence number. It's a 40-year gap since the Baum and Rothschild numbers. And so they decided to start a working group about 4 years ago to try to look at this issue. And I was part of that group. And we decided to tackle the problem by this third method, the use of large data. We developed a sensitive and specific algorithm for case finding in the US population. And we used the year 2010 to produce the denominator. And we use that year because there's a number of data sources and insurance databases that lined up with the denominator. And our estimate, at least in 2010, for the prevalence was much higher than the estimate was 40 years ago, some 309 per 100,000 cases. And that translated into 723,000 cases throughout the United States. So this estimate is fivefold, the prevalence is fivefold what it was in 1976. And a number of people, when we presented these numbers, had come up to us and said, well, what's going on? What are the drivers here? Well, a major driver is that people with MS are living longer, which is a good thing. And that formula I talked about earlier, where prevalence equals incidence times duration, feeds into that. The duration aspect has been driving up the prevalence numbers. We know that incidence since the 70s has increased slightly, at least for whites. We know from several reports recently that the incidence of minorities for MS has also gone up rather dramatically, especially African Americans. So this is probably also influencing the prevalence numbers that we saw in 2010. So there are key messages that we can garner from our work and some of the other people in this field that have kind of tackled MS epidemiology. The first point is that the prevalence of MS is increasing. And the mean age of the average MS patient in the United States is also increasing. We found that there were still persistent geographic gradients. There's a higher prevalence of MS in the northern tier states as compared to the southern tier states. And additionally, MS is becoming more racially and ethnically diverse within the country. So where do we go from here? What are the options for doing this kind of look at MS prevalence over time? Well, the National MS Society and other advocacy groups for other neurological diseases have pushed Congress to fund the National Neurologic Disease Surveillance System. This system was actually passed into law in 2016. It passed both houses of Congress and it was signed by the President. Unfortunately, the bill was not funded. So my ask to you is to encourage your congressional delegation to support and fund the National Neurologic Disease Surveillance System. This system, if it's up and running, will help us to do regular estimates of the MS prevalence throughout the country and look at its course. It will help us to be better advocates for MS patients, no matter where they live, because we'll know the numbers and we'll know the details about the disease and where it's occurring. And it will also be an important tool for researchers to understand the etiologic pathway for MS, to develop new treatments, and hopefully to prevent MS. So MS is a common disease in the United States, and the work that has been going on to date has influenced a number of people with their investigations. I think the key point is that the tool that I've outlined here in epidemiology is critical for assessing the frequency, cause, and impact of MS. I hope I've made you a believer and that you will be a better advocate for MS epidemiology in the future. Thank you.